announcement. I can't hear myself talk here. Again, weekly West Rock cleanups, Saturday morning, theoretically at 8 o'clock, although this week it's going to be on Sunday at 8 o'clock because we're doing neighbor to neighbor on Saturday. But check the Facebook page just to make sure that we haven't adjusted because of weather. Because some of us just don't like doing it in the rain. And neighbor to neighbor will be this Saturday. Breakfast will be served here at 8:15. And then we will be going out to do, hey Bob.
You're going out to do?
Wherever our teams are going to.
Can I give an updated definition of neighbor to neighbor?
You certainly could.
Because I see new faces that may not know what it is.
Okay.
Neighbor to neighbor is an effort to assist on a long-term basis. So within relationship, widows, single mothers, disabled and elderly that are in properties, and for the most part, and trying to keep them in their homes. We sometimes advocate to other agencies for help for those folks, but it's really to combat more to combat loneliness than it is to mow lawns and trim trees. Worthy effort. No more than 4 hours on a Saturday.
And it's always fun.
And it's always fun. Great people.
And the weather's always great.
Yes.
Yes.
Yeah.
Yes. And we could probably spray this weekend. But we aren't going to be
No, we
here,
aren't
so we won't
going to.
be.
Yeah.
Next month, everybody.
Yeah.
Anyway, neighbor, and it is neighbor to neighbor is a lot of fun. It's a lot of community, and if you're looking for anything close to gratification for using some of your personal time up, neighbor to neighbor is it, because they truly appreciate us and like what we do to help them. It's very rewarding. And then the third thing is the multi-use path cleanup, Sunday, April 18th from noon to 2. This is a solve.
This is a solve only because we get more volunteers that way. It's
Yeah.
actually Kathleen Schroeder that wanted to do this with a group of people. And so we assist her with getting all the tools together so she can come out and clean it up. And we've had up to 50 people with us doing these multi-use path cleanups,
Oh,
which is great.
another thing to volunteer for. I think you sign up for that either on the solve page, and I think there's a link on our page.
Yeah.
To sign up, because they like to know ahead of time who's coming. But if you want to go out and help do some cleanup and keep the neighborhood cleaned up, it's another worthwhile thing to do with a couple of hours. And you meet some new neighbors and might make some new friends.
When you say, if I may, when you say multi-path, okay, where is that exactly?
Along the
Is that-
I-205.
The multi-use path runs north and south.
Oh,
The
parallels to
spring
the
water
205?
runs east
The
and west.
yeah.
And it parallels 205.
And then what's the West Rock?
West Rock Recycling Center, kitty corner across the street from you.
Yeah?
We go down every Saturday, sort of, and walk around their properties and pick up garbage and stuff that's blown out of the facility.
Oh, I see. Yeah.
Clean up the neighborhood. It's a good neighbor policy
Yeah.
to just keep things cleaned up. You know, you've been here long enough, you know what it used to look like.
Right, absolutely.
The current management, the current owners, they're working really hard to be good neighbors. And it is a garbage facility, so there's a certain amount of it that you can't get rid of.
Right.
But they make a donation to us every month to the LNLA, which allows us the ability to buy garbage bags and grabbers, the things that we use. And we've remodeled some houses with help from neighbor to neighbor, wheelchair ramps, things like that. Again, with mostly seniors, but people who just need a little helping hand. So it's a win-win. You get some good exercise, and then we go across the street to the Mexican restaurant and have breakfast. So we're supporting a neighborhood
There you go.
business
Yeah, you get
at
those
the same
breakfast
time.
burritos.
So come out, Gary, and join us.
Yeah.
Yes, I would. As a matter of fact, I was in yeah.
It's a great thing to, we spend an hour.
You spend an hour and go out there?
Yeah.
It takes us an hour.
What do you do with the garbage you get?
They dispose of it for
They
us.
dispose of it?
Yeah, we take our bags and we put them over there by the porta potty inside the gate, and they dispose of it.
We've got access to the dump truck, just so if you ever need a dump
Oh,
truck.
I don't want to know about dump trucks. We don't want to get into anything that we need a dump truck for.
The MVP, we might take you up on that one, do the MVP.
Yeah, okay.
Hide your tongue, Char.
Well, otherwise we have to take it over to Rapid.
Yeah, well, good luck with that. Okay, anything else about our garbage things? We do a lot of stuff with garbage.
We're garbage people.
We are. Okay, so much for garbage. Now our guest speakers. We're gonna see just how things have been going
Yeah.
with your new program. So I'm gonna turn this over to you and you can give us some information and I'm sure answer some questions.
Great, thank you. Well, hello everybody. I'll try to speak up. Can everybody hear me in the back? Okay.
It's gonna be difficult.
Okay. If at any point you can't hear us, just raise your hand and let me know.
Could you introduce your other person?
Yes, I'm about to. Yes, absolutely. So I'm Robin Burrick, and I'm the program manager for Portland Street Response. And this is Tremaine Clayton. He's with Portland Fire and Rescue and Portland Street Response. He's our firefighter paramedic on our team. And then this is Karen Brooks. She's my right-hand man. She helps with communications and administrative tasks, and she knows a lot of stuff about Portland Street Response, so it makes sense for her to be here too. So we're thrilled to be here with you guys. This is actually my first community meeting in person, and it's like actually kind of exciting to see actual people and faces here. So I'm glad to be here. I'm going to give just a brief overview of Portland Street Response because I don't know what you know or what you don't know, and then I'll give you a little bit of an update. I'm told that you're interested also in hearing maybe some like examples of success stories and whatnot, and so I've got Tremaine here who can definitely, he's the person on the ground going to a lot of these calls, and so he can share some of those examples, and then we'll just take questions from the group if that's okay with you guys. So Portland Street Response, we are a mobile crisis team. We get dispatched by 911 or the non-emergency line. So if you ever want to request our services, that's the way to do it. Sometimes we get emails or requests on social media to go out, and I just want to let you know we don't take requests that way. It has to come in through 911 or the non-emergency line. So we go to calls that kind of fall into three buckets: mental health, substance use intoxication, and welfare check calls. And these calls may have traditionally been police calls, the majority of them are, or fire calls. So they would have been fire calls if they had some sort of like non-life-threatening medical component to them, like a mental health with like some sort of medical issue. We do not get calls where there's a crime in progress. We don't go to those. That's for police. We do not go to calls where there is a weapon present or somebody's threatening to hurt someone. Police still go to those calls. And we do not go to calls where there is a medical emergency. Fire or AMR are going to get dispatched to those. And
How about children?
Yes, we do go to children, absolutely. Right now, we are only responding to calls that are out in the public area, or we just announced last week, we'll also start going inside businesses or staff facilities or lobbies, but we are not going into residences just yet. We will, but we're phasing that in. So right now we're kind of starting small. We're just trying to make sure that we refine the types of calls that we're getting sent to, that our dispatchers are able to triage those calls appropriately. And throughout this pilot year, we will continue to expand sort of the parameters of what we respond to and where we're going. So just last week, we were able to announce that we slightly expanded our boundaries. So before we were using what's called a fire management area boundary, or what we call an FMA. And what that is, it's each fire station has this like border or boundary around it, and that's usually where that fire station is responsible for responding to within that boundary. And so that's the boundary that we had started with. But what ended up happening is that we were cutting off the police districts that were halfway part of that boundary, because the police use a different boundary than the fire stations use. So we decided we have the capacity, let's go ahead and make those police districts whole. So that added 8 police districts to our service area that we're now responding to. So we're responding basically from Southeast 60th to Southeast, just a little bit east of Southeast 162nd. And then from Southeast Clatsop up close to like just a little north of Gleason in a little weird place. It's not a simple box, unfortunately. So what we've just released this week was a map that you can go enter an address in, and it will tell you whether it falls within our service area for you. So you can access that if you go to our website, which is portland.gov/street response. portland.gov/street response. Also recently, we just released some data. So we've put together a dashboard in case you're interested to see how many calls we're going on, where we're responding. There's a heat map so you can see where our hotspots are. You can see the nature of the calls that we're going on. So we have like the percentage of homeless calls that we're going to, the percentage of mental health related calls, substance use related calls, those where maybe both those issues are present. So you can take a look at that. The 3 outcome goals that I want to just put out there too, that how we're measuring our success is measuring like the number of calls that we go to where no crime is being committed that would have traditionally been police. We want to free up police to be able to go out and respond to the higher acuity calls, the true emergency, the ones that have crime. So that's one of our measures. Another measure that we're trying to, another outcome we're trying to achieve is diverting people away from the emergency department when it's not appropriate. So we have a paramedic on our team who can do some of that pre-hospital care type of treatment and hopefully avoid transporting someone to the hospital unnecessarily and racking up those expenses. And the third outcome is to basically impact the number of calls that would have traditionally gone to police and fire that are non-emergency related. So that way it frees them up to be able to really address what their core missions are, which is to fight crime, save lives, and fight fires. So that's what we're trying to achieve with this program. Trey, do you want to share maybe a couple examples of calls that we responded to?
Yeah, I think a lot of the calls are kind of falling under the welfare check, the police welfare check call. And this kind of gets into that tricky gray area of like, what is the request for? Just the other day, we went to a park. It was a beautiful sunny day. I would love nothing more than just to kick back and relax in the park. And more or less, that's what this person was doing. They just happened to have a tarp to keep them, dry. And from the grass, the call really was, check on this person. If they're okay, we want them moved along. That's not something that we're probably going to do, especially in an open public space during daylight, normal operating hours. There was no crime in progress. There was no medical need, and the person was literally just sleeping in the park. So under the circumstances, we could see like why that, someone might, we saw that bag there for so long and it hasn't moved. So yes, it was appropriate maybe to check to make sure they weren't overdosing. But once we determined that wasn't the case, we just had to just leave them in place. There's nowhere to take them, and really for what reason? There was just no justification. Whereas some of those other calls where someone's being asked, same situation, but the person was sleeping in front of a doorway and just seemed agitated when the business owner was trying to open up their shop. Upon arrival, you could tell maybe there might have been a drug intoxication issue, but I did also notice that there was kind of a wound on the person's foot. So I just focused on the wound and said, hey, that looks kind of bad. Can I take a look at it? They're okay with that. I'm like, is it possible we could do so over here? Literally walked 15 steps away. Person, like before I can even finish like doing my assessment, they swept the area, opened the door, open sign is on. So we counted that as a success. I would say for the individual, we've actually encountered that individual multiple times over a couple of weeks. So I would say the outcome for that person, not there yet, but I'm confident that the multiple contacts we've had with this person, by the third time there's definitely recognition. That was probably one of the first calls where police called us out to assist. And again, it was blocking a doorway. The person seemed to be agitated with police. Because they recognized us, they calmed down a little bit. It was still some colorful language on their way out, but they left, you know. And so we're not, you know, it's really a different approach. When I would have responded to that same person with the fire crew, if I made contact, I would say I've now contacted this patient. Now I have to do some vital signs, and now we have to have a destination. The hospital's not the right place for this person. They need drug treatment, but they can't be forced into drug treatment because most of those are voluntary. If they volunteer, there's a wait list. There's a lot of processes that this person has to go through to be successful. So really, if we're going to encounter them, I think it's going to be, and we're also, now that we've recognized this person, when we're out and about, we're looking for them too, right? So ideally, we would find them before 911's called, and we could do some interventions that way. So that's kind of on the welfare check. On the mental health, you know, it's kind of still hard to say what is an actual underlying mental health, like schizophrenia, versus a drug-induced psychosis, right? So that's kind of one of the things that we're still working on. We're looking at some medication treatments, if there's anything that I might be able to give somebody in the field to try to help them start to do their detox. But again, we have to weigh some of these things because detox, a lot of the folks, they're not using because they're just junkies, they're using because they're sick, right? And when you look at some of the opiate statistics, we're in the 70th percentile where most addicts were started on a prescription medication, right? So I'm encountering a lot of folks who, they're on the street because of that one bad car accident. They didn't have insurance coverage because their job didn't provide it. They're on prescription drugs, they get addicted, they go to their appointment, they lose their job, and then they're just in this cycle, right? And so now they start using drugs to maintain that sickness level because detoxing is the danger. It's not being high. Being high, there's tertiary things. If they're not aware, they walk into the street, that's bad. But it's the detox that is the medical process. So we're still working with that. And again, it's just, you know, a matter of, like, we can't force people into these situations. So it's really trying to say, how can we treat them in place and then gain that trust so they know that we're a safe place, that we can help them navigate the system. We're not going to cure their homelessness, not going to cure their addiction. We're going to give them those steps that they need to try to navigate the system to get to that place themselves. So really, we're just trying to give a hand up. And then I think the last one that I would say, which is the super positive, is we encountered a homeless individual. She was pregnant. We connected her to one of our CHWs. She was an immigrant, and we were able to look at some of those immigrant resources, and we were able to actually get her housed. So we have one housing success. I guess that's 2 housing successes in my 3 years of doing this. So baby steps. But I would say definitely having the resources of our community health workers, that's why I'm super confident in this model. When I was working this CHAP program, the Community Health Assessment Team program, working with high utilizers of the system where I was doing these one-on-one contacts to navigate for this person, all the steps that I have to navigate. Oh, there's another call, and then I got to go over here. It was near impossible. Having people that could come in real time. And actually, they're usually on the phone. Do you need me? Do you need me? It's really awesome to be able to get a start of the wraparound service, like almost instantly. Probably no more than, I'm guessing, 24, 48 hours when we get really busy, that we'd be able to make that contact. And I think that's probably going to be one key to our success. Usually when we're calling for services, you get on that wait list and it just kind of feels hopeless to just, you know, I'm on another list. At least right now, we can connect them to health workers that can sit with them for a little bit longer so we can be back in service. And just that human connection is what a lot of folks need. And we're starting to see some pretty good connections with our community health workers.
Yeah, Tremaine, I'll get to you in just a second. I see your hand. I just wanted to say really quick, because he reminded me, I did not tell you this, but I wanted to make sure you all are aware. So the way that this works is that 911 Dispatch Center will dispatch Tremaine, our paramedic, with a licensed clinical social worker. And so the 2 of them go to the call. And we have 2 other people on our team called community health workers. And they are available to co-respond on that call if we need them. And their role is really if somebody needs wraparound services or referrals or connections
How
to
many
social
do we
service.
have of those?
What's that?
How many people do we have right now?
Tremaine? We have one team right now. This is the
That's
pilot.
unreal to the homeless. I mean, that's why we have a problem.
It's a pilot project.
We're going to be
Oh.
expanding citywide. We're going to have many more teams. This is a pilot. The purpose of this pilot is to assess the types of calls first that we need to be going on and figuring that piece out in our protocols. And then we'll expand it once we have that solidified. So the hope is, or not the hope, the plan is that we will expand next year, next spring, 2022, citywide. Okay.
Well, first of all, do you work with the 11s?
Station 11?
Yeah.
Yes.
Is that kind of the impetus for having this program piloted in Lents?
So when we found the pilot project, founded it here in Lents, it was due to lack of services out here. And the fact that we're piloting with one team, we didn't want to be overwhelmed. We know that the downtown core definitely needs services, but we didn't want to overwhelm the one team. We wanted to work with dispatch. That's probably the biggest key. I would say it was 2013. I was on a project trying to address some of that high utilization, trying to find alternate destination and transport options instead of the emergency department. But I would say dispatch was the biggest component missing. So I was sitting on a 2-person rescue that was designed to keep fire suppression vehicles in service to send us out on lower acuity calls. But dispatch, well, it's a chest pain. You might need 4 people for CPR. And I was like, well, but it could be anxiety. Maybe they just need to talk it out, right? And so now we have dispatch working with us to really fine-comb those calls to make sure we're sending the right resources. And so by coming out here to East County and to Lents, we started with the fire management area, which was a perfect 5 rectangle. It's kind of hard for me to say square miles when I know 11s is a rectangle for their FMA. But even in that, that's where we were saying, so like if this Palm is FMA 11, this police officer was touching 11s, so he could call me if he was in Fire Station 11, but if he was in 7's FMA, we couldn't go. And that's where we're like, this is selling the police officers short, given that they're the ones that are being called out on these lower acuity calls. We want to free them up so they can do the high crimes, the gun violence and all that stuff. We want them free for that. So we expanded to the officers that are touching those areas to try to expand that. And then also that kind of gives us a better look at our citywide expansion, so we know that we're hitting the right calls, so that when we do go citywide and we know how many teams we actually need, we could then go from there.
Char, I saw you.
I was, the navigation teams have been out here for years, from my understanding. Where do you play the role with that? Do you guys work alongside them? Do you have any interaction with them, or?
So when we were gearing up to this, a lot of the community outreach that I was doing was through the joint office, and we're still partnered with the joint office. So a lot of times it is a case by case, like we have this client, we know they've been working with this person, and that's really what we're trying to do, is fill some gaps and figure out who is actually working with this person, because we have been noticing that with multiple agencies out there, as coordinated as we're trying to be, we'll have 3 or 4 different entities working with one individual going nowhere. And so really what this is trying to do is, especially with our community health workers, is navigating that piece to say, oh, you're working with this person, in real time we're going to contact that person and say, if you can't, we will, so we can help navigate that individual.
Okay, because I'm wondering, because you have the navigation team and you have the Portland Street medicine out here, and it's like, now we have you, and it's like,
It's not enough.
But the need is there, right?
The need is there. Yeah.
For
It's not
and
enough.
the trick is just collaborating and really coordinating. Yes.
Did I hear you correctly that you said that your boundary goes as far north as Gleason?
Yeah, there's
A
just
small
like this
step.
really weird
then-
piece. Yeah.
How far, let's see, that's north, how far east?
Southeast 162nd. Just,
Really?
just
That's a big area for this.
Yeah.
Yeah.
You see, I live next to Floyd Light Middle School. It's right across from East Point Police Precinct, and yet you would believe when a situation needs attention, it's not easy to get some attention on the situation, and some of it is
Average
pretty
wait
serious.
time, 911. In our neighborhood, have you called 911 lately? Average wait time is
I've-
5 to 8 minutes.
Right, it's
Like
gotten
on
better.
with
but-
dispatch, you mean, or
Yeah.
with, oh, okay.
I reported 3 fires on Cindy and I wasn't on hold more than a minute.
I've worked real
I had
close with the
two,
principal for like
And it
middle
was
school
on hold
type
8
piece.
minutes, and then 6
So then
seconds.
before I ever take off in the car, I kind of drive a certain route and see what's going on. I live in Mill Park, which if you look at Mill Park on a crime neighborhood map, it's a very light color, in part because I work together with Doug to keep some eyes on the neighborhood, and yet it's surrounded on 3 sides by Hazelwood that has the highest per capita gun violence. So there's an example right there that,
Craig, do you have a question in there someplace?
right, so I can contact him for this area. And please don't be so critical, I'm here for a positive
I
reason.
understand.
Yes, yeah, call 911 or the non-emergency number, that's how you can utilize our services.
Thank you.
Yes.
Is there a way that we can know who at the city of Portland is dealing with specific people?
I think you would be into confidentiality stuff at that point, so probably not.
Oh, you mean like, you mean the actual people we're responding to?
Yeah, like if we have people that are out in front of our home for a long time, it'd be nice to go contact a person in the city of Portland that's handling this case and inform them of what's happening. Because we need relief.
So the only thing I'll say to that is the way that Cahoots in Eugene handles it. I remember I did a ride along with them, and they responded to do a welfare check on this one person. This person was in mania. They had bipolar disorder, and a family member was like concerned about them. This family member did not live in town. We went and checked on that individual, made sure he was okay. He was in fact in mania. He was in denial of it. They called the caller back, and they said, if you want us to come check this person, just give us a ring. This is our, call 911 or the non-emergency line and tell us that you'd like us to do another check. You've got it in the system. We'll know who this person is. We can do that follow-up. So I think you'd have to go through, similar situation. You just have to go through 911 or non-emergency. But also, I know, Tremaine, have you called any of the callers that you know? Yeah. So sometimes when we're en route to the scene, we can see the number of the person that called, and we can call them before we get to the scene and just kind of get some background information. And so that's an opportunity. Like you can definitely let the dispatcher know that you're open to being called and contacted, and we can do that.
So are you guys dealing with the multiple use pass at all?
Some.
Okay. The city of Portland went through from Burnside down to Flavel, I believe they're at now. And they've given these people days and weeks and months to give shelter. And these people have refused and rejected shelter for months.
I can't say that it's just a straight up refusal. Even when we're trying to do our outreach, they give us the 211 contact for shelter, and there's just no shelter. So it's not that they're refusing shelter just because they don't want it. Sometimes they want shelter and it's just not available. There are other issues where it feels like several of the people that we've been working with have been assaulted physically, sexually in shelter. And so to ask them to go back to that place for safety, that's not a safety place for them. And then that's the other thing that I'm learning about drug use. People aren't doing drugs because they want to die. So they will do drugs and they'll be in that public space hoping that someone calls 911 because, like I said, the goal's not death. The goal is to not be sick. So user amounts to try to maintain, and then the circumstances, and then there's bad stuff on the street, they go down. That's a lot of the reason of the why. We just don't have the follow-up services in the shelter space right now.
I was told that they have to have shelter in place to do a campsite removal, and that's what the point was, to go through the MVP. So shelter was available for these people, and they rejected it and they declined it. These people are still in our neighborhood, and it's unlivable, intolerable. We've lost our patience. It's dangerous.
Yeah.
I had 5 bombs go out outside my home in the month of February. That's 28 days. I mean, I could go on and on, but I'm wondering what we're doing with people that reject, refuse shelter. And they just want to stay out in the street and do whatever the heck they want to do and disrupt our living, our sleeping, our living, our everything. It's tension 24 hours a day where I live. And every single one of my neighbors feels the same way I do.
What's your address?
Where do you
One block
live?
south of Holgate.
Walk south.
Okay,
One block
what?
south of Holgate.
By the park?
Yeah.
Right across from the park. I
Okay.
live across the street from an open green space that's been occupied for over 1 year. Over 1 year.
Yeah, during COVID, they stopped doing sweeps for the sake of COVID spread. When they would disrupt a camp, they would then go to other camps and relocate within new groups. So that decision was coming from a county level in terms of the epidemiology teams. And again, when they had to revamp shelters, they had to disperse the people that were in shelter already. They've opened up some motels, COVID-specific motels. They're putting people in places. I understand what they're saying in terms of shelter has to be available, and I know that beds, 1, 2, 3 beds are available. I've been on your street. I know where you're at, and I've been on that multi-path. If we even got maybe 6 people that said yes, then you're done for the day, maybe the week, maybe the month, because those 6 beds are available. It's a numbers game. We have about 9,000 people living on the street. For everyone that gets
9,000
into
people?
shelter,
9,000?
that was the last point in count. That was the last point in count.
2,000, I think.
What's that?
I think in the news it's 2,000.
2,000? Well, I might have my numbers off. It's been a day,
But let me
but
ask you, so what is the policy for the people that refuse shelter week after week and month after month?
that is that's
They
going.
remain where they are.
That's a 1 point count. Hercup question. Portland Street response is not that.
Who can answer that?
Luke
Um,
Hillier.
Johnny,
Johnny, yeah.
Johnny, you've been.
Johnny or-
I've been in contact with
I know
Johnny
you
for
have.
4 years.
I know, but that's not something that we could solve as Portland
Johnny's
Street.
not solving it.
Yeah.
And I can't solve that.
Tremaine, you guys work with Vitae Lake?
I've not had success working with Bivey Lakes.
Really?
I have not had success working with Bivey Lakes.
Why that?
I'm not able to figure out the process. I've had people that I thought were perfect candidates that were not accepted into service. The people that our crews have tried to get in usually have been code 3 hospital out. So we're still trying to work that out. They're new, we're new. I think we'll get it. We have to still work on some of the referral process. I think there was a comment over here, and then we'll come back.
Well, I was just going to voice another concern. I know for a fact that there are some criminal people that are using this COVID thing for a complete excuse. We have a camp that's been behind us for over a year in an environmentally sensitive area. The thing is huge. They've taken a carport, covered it with tarps. The guy is hoarding is what he's doing. He runs a hoarding operation. He pulls up there and constantly stuff in and out of there. He is connected to all the basically criminal entities on the trail, buying and selling used merchandise. And he's lives in the apartment that's up the street. They've had other homes and other things in the area that we've had to deal with. And then the gunfire and the bombs all the time. I don't know what they're doing with the bombs, but that's a constant situation. It's kind of slowed down lately, but this summer it was pretty intense. And I've tried to work with the police and whoever that would listen about this problem, and it just keeps getting back to the same thing. Oh, it's COVID related. Well, it's.
We don't have we don't have the
We don't
resources,
COVID.
you know?
It's,
We're tired of this.
5 years I've lived with them across the street. 5 years of every story you can think of. And this is after 5 years. I'm the same woman, lived in the home for 40 years. My conclusion is we've allowed them to break the law. Okay, we've allowed them, and so they've been desensitized to any rules or laws, and they will look at you in the face. They'll come in your yard. What are you doing here? Please leave. What are you going to do? Call the police? Go ahead. You know, they threaten you with that. I can tell you story after story, but the thing is, great resource, and I'm glad for you. Not enough, and I'll keep saying not enough. But it's not enough for what we're going through. We're past this now. We're past to the point that we've got people constantly breaking the law, and the law doesn't protect us.
I mean, we can deal with
The
the
law
crazy
doesn't
stuff.
protect us anymore. And
And
I'm sorry.
unfortunately,
but
these
hope
poor
is-
people can't help
I
that.
know. And
The
so
hope is that
it's
they-
great. I just wish there was more. That's all I can say. And hearing this, and it's wonderful, it's great.
The hope is that, like, if we take some of the calls that take a lot of time that the police are responding on.
We're so
and-
frustrated
And
now.
I understand, I totally do. And we all live in the city of Portland, just so you know.
Well, you don't live across the street where I live. Or him. Or him.
How can you guys understand unless you live it? I mean,
I live in North Portland and I have the same problem out there. And the beauty that I have about this is the fact that I can try to make a change in my neighborhood through this work.
And
That's all
we
I can
try.
do, right?
24
I
hours a
understand
day,
that part.
I've got this going on.
I want us to stay on track. This is great conversations for the Commissioner's Office and or Portland Police.
You don't hear.
We're
They were
Portland
here
Street
last time,
Response.
and
And
they said the
Last
same
time,
exact
all we
thing.
got from them
Nobody
was
hears it.
So I have a
excuses
question.
and reasons why
What
they can't.
stats
Can't.
do,
Can't and won't.
okay, so you accumulate stats, right? That's how they get their numbers. When do the numbers accumulate enough to get another, I mean, can we make it quicker than spring?
Oh, okay, good question. Yeah, so we are actually adding a second team in August. This team will respond in the evenings and during the weekends. So it'll be 4 p.m. to midnight, and it'll cover the weekends as well. And then we are not able to add another team until March of 2022 because of the Bureau of Emergency Communications. We call that BOIC. That's our 911 dispatch center. So they have to build the infrastructure in order to be able to support enough additional teams to reach across citywide. So it's not our capacity, it's the BOIC capacity. And they're working on that. So they've had to hire 8 additional FTEs or full-time employees to staff to be able to support a citywide launch for us. And it takes 18 to 24 months for them to train up a dispatcher. So that's what we're waiting on. They've hired that person. They're working on getting them trained, but they'll be fully trained and ready to go by March of 2020.
So once that happens, does then it become a quicker
Yes.
turnaround? Once we get this infrastructure into place and we get the numbers and the stats moving in a manner that they are listened to and heard, I know they're heard now, but it becomes quicker,
Yes.
right?
How about a Portland response team for us? When we have issues, he has issues, I have issues, my whole neighborhood, that will come out and listen to us and deal with our issues with what's going on. Because I know each area has something a little more worse than the other, but it's still horrible, but it's never answered because the police, nobody can deal with them.
Yeah,
That's not our answer.
my recommendation to you is to take that to your elected officials.
Oh, God, the letters we write, the phone calls, the emails.
Oh, the one point of contact, I
To
mean,
try and get anything to the mayor or city council, they don't
No.
return phone calls, they don't answer
Phone
emails,
desk.
they don't even show up for work. You might as well have an empty desk down there.
I have one in the back, don't come back.
A question, do you know, with the money coming in, I think this summer to address homelessness, if they're gonna build a good data system, so like Portland Street Response, city councilors, Multnomah County will have better data so we know who's on the street, what their needs are? Because I know right now it's hard because everybody's sort of like operating in the dark, left hand doesn't know what the right hand is doing.
Yeah.
But if we had really good data, like if you could present and say, we have these many people with chronic drug addiction, we could go all the way to the governor and say, we need some recovery centers. But without this data, it's hard for all these folks to work together.
Oh my gosh, I love that question so much.
She's all about data. She loves data.
Before I took this job, I managed the data analytics for Portland Fire and Rescue, and so I'm all about, absolutely collecting that data. And we actually even just had a conversation today with another outreach group that's here in the Lents neighborhood saying, how can we combine our data and really start aggregating all of these numbers together? Because one of the things I've told council that I want to achieve with this program, we all know the system is broken, but I really want the data to point exactly to where the system is broken so that they can actually start funding and building the infrastructure because we're impacted by those gaps in the treatment system. Like, there's only so much we can do with someone that's intoxicated if there's no sobering center or treatment facility, right? So we are absolutely, and I have conversations with the county quite often, and I'm happy to actually pursue that. I think it's a great idea of trying to work together with them to collect that data in a centralized place. I will absolutely follow up on that.
And we actually had a meeting with Senator Wyden,
Yeah.
who came to town literally to talk to the team, and he asked questions like, if we could give you one thing, what would it be? And we talked about a drop-in center or places to take people, because that's the number one problem, is like where do people go, right?
And this coming Tuesday, I'll be getting to go to DC virtually to talk to our local law makers, our senators and Congress folks to talk about more funding options and trying to bring this type of a program with the treatments and those other gaps in terms of Medicaid, Medicare for payment, because that's really the funding part of it too, to make it sustainable. And that is the hope, that we can start at the ground level, start to build that out to try to improve the system.
I want you to make a presentation to the David Douglas School Board and Administration. And the reason why is if you look at a map of David Douglas, it's just huge out at East Portland. It goes past Foster, in fact, goes way over, I think, to Halsey. So when somebody comes, they no longer have a school resource officer. So I live next to it. I see a lot of things happen at the school I live next to. When somebody comes through waving their arms and tearing their clothes off, you can't call a resource officer anymore, and maybe not a policeman, and people on the move. So would you be interested in making a presentation so all these teachers and principals that got eyes all over this huge big area would know who to call if they need help?
Sure, absolutely,
David Douglas.
Yeah, sure.
Yeah, it's just huge, the property it covers, and I see these things happen all the time.
Yeah.
Okay, thank you.
First off, I applaud your compassionate hearts for this situation that we're all tasked with. I want to share with you a story that is a true story, and it's that my wife's nephew happens to be a police officer with the Phoenix Police Department, Phoenix, Arizona, for 29 years. He was up here for a funeral visiting, and he says, we see on the national news everything's happening in Portland. Gary, what you got your head on the street here, you know what's going on. I said, well, it's kind of out of control, literally. And I said, but you're from Sun City, don't you have a homeless problem there? And he looked at me and he said, well, we don't really define it as a problem, but we treat it, we enforce the law, but we do it compassionately. I said, wow, you've got me now at compassionately. How do you handle this? I said, well, first off, we've got laws for vagrancy, we've got laws for littering, we've got laws for all this stuff. And so when we encounter these, the police, when they encounter these individuals that are breaking these laws, setting up their tents on sidewalks, whatever it is, they give them two choices. They say, we can take you to jail, 30 days in jail, or we're going to get you into these social programs, which raises the question, do we have the resources for these people? We do. Millions of dollars. $58 million was spent last year in Portland. I know that. So I said, okay, so what happens? Well, he says, a lot of the people are on drugs. And just like you explained, they're on drugs because of what happened to them. He said, so, I said, so what do you do if they don't want to go? Well, we take them to jail. And he says, about a week. They're maybe not quite that long. They're ready to get into one of the programs. So what we're doing is we're using the law that has been on the books for many, many years to funnel the people to get them the help that they need. Does that make sense? We're funneling them. So I said, okay, so what about the guy that you'd send to jail 30 days, and he does his 30 days, and he comes out? And he says, and he sets up his tent again. Well, he said we encounter him, we give him 3 choices at that time. I said, 3 choices? He said, yeah, we're going to give him back to jail 30 days, help you get into the program. We've got churches, we've got anything you need to help rehabilitate yourself. Or we're going to give him a bus ticket. And he said, the crazy thing, I checked, and most of them are wanting to come to Portland.
Of course.
Yeah.
And I sat there in absolute, I was devastated. We were at a funeral, for one, okay? And he's telling me this story. So again, I applaud you all for your compassionate hearts, but until the mayor gets the police department, and you are not police, you are social servants, that God bless you all for your service. I really mean that from the bottom of my heart. But until the mayor lets the police department start doing their job and enforcing some of the laws that can help not only your street response here, to help steer those people into getting the help they need. I'm compassionate, but I understand this gentleman, I understand her, I understand her. My business is on Foster Road, and I'm watching these motorhomes growing from a project that I helped put in place that removed 11 residents, their homes, to recreate the Johnson Creek watershed. And it is destroyed now.
They're breaking the law.
$28 million of taxpayer money. There was a video now of an aerial view of what it looked like before and now what it looks like. Anyway, I applaud you all. I just, if you're going to take something, by the way, you're going to Washington, D.C. virtually. I'm going to tell you a hint. I go to Washington, D.C. every year to lobby in my industry, okay? They have no clue of reality. No clue of reality. And I don't mean that sarcastically, but they don't. They wanted to ban any vehicle that had any kind of a recall. And I'm sorry if I'm taking up too much time, but this is how out of touch they are with reality. They wanted to ban any vehicle that had a recall on it and make it stop. You own a car that's got a recall on it, you couldn't drive it. Because that was the legislation. We lobbied against it. Explained to the legislators that the manufacturers don't have fixes for many of these recalls. So their car would be worthless. Okay? So we stopped that. So I happened to ask Wyden's right-hand staffer. I said, well, so what kind of car do you drive? Because I'm going to Google it and see if he's got a recall. He says, well, I don't have a car. I said, you mean you don't have a car here in Washington, D.C.? Well, no, I just don't have a car. And I said, well, what do you do? He says, well, I ride a bike. And Blumenauer's the same way, ride a bike. We're riding bikes. We don't have a car. And so they were out of touch, just in my little industry thing, they were out of touch of what a recall really was and how it would affect the people until we explained it to them. So I applaud you for doing this, but you got to explain to them the problem in depth. That this neighbor, that neighbor, with the governor, the mayor has to be a gun to their hiney to say, listen, we need to do something now. It's epidemic. COVID's an epidemic. Homelessness is an epidemic in the state of Oregon, or at least in Portland.
Absolutely. AMR responds to a lot of mental health crisis, right? They'll pick someone up, hospital, 24-hour hold, back out in the street again. Where are you guys with AMR responding to some of these mental health crises?
Actually, we're looking at some of those calls because the emergency department isn't always the best place for mental health. And so the gray area for that is that AMR is contracted with the county as the transporting agency. So even though we, the fire department, have, even Rescue 11 looks like an ambulance, we're not designated as an ambulance. So ideally, if we were able to sit somebody upright so they're not laying on the cot, we could try to take them to like Unity or Providence for their behavioral health. So that's one of those things that we're still trying to work out. I would say that thus far, we had a client where we met them, they were drug affected, and it felt like their safety was the issue. So I called for a transport, and it was sad because the very next morning, just like you said, we're going on the same person. And I made the joke, I'm like, did AMR make it to the hospital? Because they were only like maybe 10 blocks from where we had met them the day before. But they had the hospital bands, cut that one off and get them back in the rig to go again, just because the safety, it really was a safety thing. And even in our intervention, we just couldn't maintain that person's safety or our own. Well, I felt we were safe, but I mean, you do have to factor that in because we ultimately had to restrain this person. And you could see the trauma in this person's eyes when you're doing that. And that was the last thing we wanted to do. But that's what, for the responder safety, we just couldn't comfortably move this vehicle without, and then maybe they jump out of the back if we didn't do that. So we're still working that out.
There's so many people that are unemployed at this time and need employment. What are the resources that are being put out there to get the jobs met that you are, like, grow your teams? Who's promoting that? And where do they go to find these resources? Because there's a lot of people that are still unemployed and would love to have the access to have an income and are skilled. How do we get that out there for them so we can grow you faster?
Are you talking about joining our team? Is that kind of thing?
Well, your team and also accommodating additional teams. Like, for an example, a contractor, once he gets overwhelmed with his work, he hires on another team. And he does it in a manner that is good for his business. We need to run this as a business. Because if we all ran our businesses like the city of Portland is running this now, we'd all be out of business. So what I'm saying is how do we accommodate you or the resource that allows us to get the information out to the skilled workers that can then grow with the stats that you get? How can we help?
I'm not sure I quite follow.
I mean, as we grow and we post jobs,
When you post the jobs?
we will post jobs, yeah.
No, I mean,
Where? We
So-
posted on our website, or the city, portland.gov also has a careers link that you can go to for that.
And our social media is
Yeah.
also, so our Twitter page and our
Yeah.
Facebook
You
page.
can follow us on social media.
Are you on
Sounds like
Nextdoor?
you need a facility is what you need.
We're not on Nextdoor.
Nextdoor is a
Would you like us
really
to be on Nextdoor?
Yeah.
fantastic resource.
They
Okay.
have issues, but
So,
you guys can step in.
I know that they're picky about which public agencies are on Nextdoor. Like I actually ran our fire one. I can get in touch with them and see if they'd let us as a separate agency
Yeah, there's a
get
lot
on
of people
there.
that go on Nextdoor.
One more time. How many calls about are you answering a day?
It's about 2 a day. Yeah.
And the other 7 hours a day you are,
We're waiting. Actually, let me clarify something, and then Jermaine, if you want to add to it too. So again, there is the 911 first response that Britt and Jermaine do, but then there's the follow-up piece. So that follow-up piece is also consuming the other time that we're not actually responding to a 911 call, if that makes sense. We do a lot of follow-up with a lot of individuals, so just try to get them connected to wraparound service.
And some of the calls take a long time.
And the
so-
calls do take a long time.
We went on a call together that went over several days and took many hours. And I think ultimately we helped the business that had called us, but it took a lot of time.
We're also driving around Lents as well, looking and being available as well. So actually, Tremaine
So
ended up
if
doing
you're driving
CPR.
down my hood and I live on the Springwater, and there's an issue going on across that fence, and I see you driving down the street, I can do with you that I do with the police department, which is wave my arms in the air and jump out in front of them and smile and stop. How you doing, Penny? What can we do for you today?
You can do that. We can self-dispatch if we come across a
Yeah.
scene while we're out there and you wave us down. We can self-dispatch and let dispatch know that we're responding to a call. Yeah.
And we'll have better marked a van soon. It
Very
just hasn't
soon.
come in yet,
Yeah.
so.
I haven't seen your van on Glenwood yet, but I keep waiting.
On Glenwood, I'll make a note of that.
Need us out of the house possibly for good, so you wouldn't have any other reason to be down there.
Yeah, no, and then we're also looking at other practices. I've been in contact with Denver, Atlanta, and other agents, Chicago, other entities that are doing this, that are getting this stuff out, just to say, are we doing this right? We have, why do I keep forgetting the term? Supervision with psych nurse practitioner.
Nurse. Yeah.
To kind of discuss the calls and try to make sure that we're doing best practices. So there is a lot of administrative training that's continuing on as we're still growing this out, building a training manual for the next team so we can onboard them quicker, and just trying to get a lot of that future planning stuff in place so that not if, but when we grow, we'll be ready to absorb that.
There was a question.
I just wondered, do you ever walk into any of the big camps? It's kind of a wellness check, or see what's going on? Because there are some really huge camps.
Yeah, and I don't know if I answered that in detail. So when I started off as just the chat coordinator before Portland Street Response was launching, I was working with the Joint Office of Homeless Services trying to do that street outreach. And really that's how it kind of started for me, was looking at high utilization, but with a homeless client, there was no address to follow up on, versus if I went to Joe's house 7 times, I would just go to Joe's house and say what's going on. When that's the case with a homeless individual, I literally would have to be proactive. And that's kind of how the response model came about, telling the crews, call me in real time when you're with this person so I could follow up in real time with this person. In doing that, I got in connection with the Joint Office, with the navigation teams, and started doing outreach kind of in this area just to try to understand the area. It was 20 years ago when I lived over here. Definitely has changed. I acknowledge that. So we were out here, and then we had a contract with UP School of Nursing to be a clinical site, and then due to COVID, we had to shut that down. And then when the wildfires came about and we were trying to redistribute masks and water out to the neighborhood, they started helping me with the outreach. And so it was usually with those outreach teams that we would be going down the trail trying to connect to resources, trying to find those medical needs, seeing if there's people that were medically vulnerable that we could get into the medical shelters. And so that's really a lot of the outward progress we've been doing with that.
Also, when, later on, when more shots are available, do they going to do outreach to, like Johnson, where it's 1 shot, and some of these large camps, and
I know that's on the agenda, and that's the advantage of having the UP students. That would be our workforce, and versus the 4 of us, we wouldn't have the capacity. So that's one aspect that we're looking at with the county. Yes.
I have a curiosity question, because I always hear about the COVIDness, why they can't deal with the camps, blah, blah, blah. How many people are coming up with COVID and that are sick and dying, going to the hospital, that are homeless? What do you think the majority is? Because I haven't even heard of one.
Well, I know that they had 2 COVID hotels that when people would be encountered, that we encountered with symptoms, we'd be able to send them there. They would do the testing, and AMR was trying to do mobile testing, but it just wasn't efficient, so we were finding ways to get folks to the mobile
So
sensors.
we don't have a
I don't know
number.
the stats, but
Yeah.
I'm
Yeah.
sure somebody's gonna.
No, that'd be the Office of, Joint Office of Homeless Services that was operating those motels and hotels. In the back?
Sorry, wish we had the numbers for you.
I think it just seems weird why they can't, why they can't use a COVID, but
I'm sorry.
Oh, sorry.
Oh, sorry.
Just as a note, anyone who's houseless can get the COVID vaccine for right now walking up at Outside In. They're getting the Johnson & Johnson, so it's one shot and done. So if you ever run into folks, that's a really good resource for them to know about.
Where was it at? Where?
outside in.
So what you need is a facility of some sort. In other words, it's pretty hard for you to do anything mobile when you don't have I mean, this seems to be a big problem.
We are really excited, though. The county is working on a resource center that will be a crisis walk-in for us, and then they'll also have another floor for shelter, and then another floor for transitional housing. Particularly, I think it's for individuals that are going through treatment or substance use. So that'll be an opening, I think, next year. I can't remember if it's the spring or the fall. Do you recall?
I think it might be fall.
Fall 2022. That can't open soon enough, but we're really excited about that. That's going
Do
to
you
be
think
downtown.
it'll help if it's got a walk-in place that you can get some of these people that
Yes.
will actually come before they get to a crisis part
Yes.
where they know that they've got an episode or something coming that they
So where is that
have a place they can go to?
Downtown.
That'll be downtown at like 4th and Pine or somewhere around there.
They won't go, not in our area.
No, and actually, I'm advocating for more of those around town. But I did speak to Washington County, who has a similar mobile crisis team as ours. And as soon as they opened those walk-in crisis clinics, their mobile crisis calls went down because people would rather go and be face-to-face and get those services than have to have, a first responder come to their house. So, or respond to someone. So I think that that's definitely something I'll be advocating for more of in our future.
I think I'd like to advocate something I just shared a little earlier about asking for a Portland street response for us. And I want to say why is because all of us have called the police at one time, the ones with issues. All of us have, most of us have written letters, emails, called, so on. And so we can't do the mayor, we can't do any civic leaders, any senators, any whoever. The police know. So we're kind of got our back up against the wall every time we have issues in our neighborhood, right across the street, next door, you name it, about homeless issues and the people and our problems. We're at lost. We have nowhere to go anymore. And we end up feeling that we are the ones on the outcast because nobody hears us anymore. I've spent 5 years of this, and right now, most people know I feel a little angry that they have allowed these people to become lawless, break the law, so they're lawless. They don't care what they do. And we live with it. So we're living with the lawless. They're not, we are. And so we need someone to be our advocate. Because we've tried. Nobody's out there anymore for us. Nobody hears us. Nobody listens. Nobody will return our calls. Nobody will write us back. Do you understand?
I mean, when you're shooting off an AK-47,
Oh, we've had 2 fires this week.
You call the police and they say, oh, unless there's somebody.
Well, the one camper, it took out all of
Yeah, we lost
the camper
our
was on fire.
internet. I live right
And
out
check
there,
out-
112th and Brookside, right there across
Check
my
out
street. I've dealt with the homeless since 2014. The day after Charlie Hill said, let them camp on the streets. That next day, they were partying in the park, that little nothing little park. And my husband and I out there walking the dog, and they're drinking and doing their drugs and doing all this stuff. And I'm like, we hadn't seen this. We go, the signs say not to do this. They go, we'll call the police. My husband says, okay, call the police. Well, do they have guns? Are they threatening you? Do you have knives? And that's what, every time you call about anything, that's what you get your answer back. So please go back, and I'm so thankful you're there. There's not enough of you for what's going on out there. But please ask for an advocate for us. We have nowhere to go, no one to call, no one to write to because nobody's listening. And I'm thankful for the people who've dedicated their lives to trying to listen to us, take our talks, take our whatever. But right now, we are backed up against the wall, and what's happening is people are moving out of Portland. We're sick of it because nobody hears us anymore. And it's us. We're paying the taxes. I'd rather go live somewhere else and pay my taxes. But I was born here in Portland, Oregon. 68 years I've lived here. 68 and a half now.
You know, we improved our community immensely.
And we're here because we hear this and it's great, but we're here because who's going to hear what we have to say and help us? Because we're not getting help.
Well, can I just say something, and then I'll let you speak. I just want to say thank you for sharing, and I feel your frustration. I understand where you're coming from, and we do meet with Commissioner Hardesty's office. We'll share what you've just shared with us tonight with their office.
I mean, our lifestyles have changed. Most of us don't go for our walks. I can't ride my bike. I bought this beautiful bike. I go on walks. I have to leave my neighborhood.
Yeah. What I appreciate, even like before we got started, was seeing how much you guys invest into your community, and I know that you guys care a lot about making your community a livable one, and I can appreciate that. And just know that we're working alongside you. We're trying to build a stronger community for you as well, and a safer one as well, okay?
Well, we support you with trying to get your facilities
Yeah.
that you need to, in order to make that kind of stuff happen, because, you know, you can't just take these people and just, you know, take them to the hospital and then turn them loose, and then they're back 2 days later, the same thing. It's a repeat problem. You've got to somehow break the cycle.
It's such a complex problem. It's so complex,
No, it's
but I
not.
can tell you.
It's called the law. We obey the laws. Make them obey the laws. Make it so that it's crucial. We desensitize
Well, there's the
them,
criminal
breaking the law.
entity in with this, though, that's also infiltrated into the homeless, because it's easy for them to hide, and it's
Yeah.
how they get away with their
Yeah.
criminal activity. They prey actually on these, you know,
Yeah.
sick people that have no place to live and that have been impoverished and different things, and they prey on them, and they prey on the neighborhoods and everything else. And unfortunately, we haven't been able to convince Hardesty and Mayor Wheeler and everybody that there is this criminal entity that still needs the law enforcement dealt with. You know, you can tell the difference between a mentally ill person that's fairly well harmless and somebody that's, you know, that is a, you know, a ploy to get what they want, because they don't want to pay like everybody else. You know, they don't play by the rules at all. And like I say, they're treated like honored citizens.
Do you want to go to you?
Yeah, I want to reiterate what this gentleman said. Thank you guys for your compassion. We're not against you guys. We're living in hell. And we need, I don't know how many advocates the homeless have, but we need a force from you guys or somebody at City Hall that's explaining exactly what's happening to all of us.
Well, I think the threat is that if they don't do something in City Hall, would be that they're not going to be in City Hall when they come for re-election. I can almost guarantee that. Would any of you vote for who's in office right now?
Well, the trouble is when Mayor Wheeler got elected in the first place is because he had a very weak opponent that didn't have any experience or any credentials. And, you know, so everybody's like, well, at least he has some, but, you know, we all know he doesn't, so.
Well, I voted for Wheeler the first time because he ran on solving the homeless crisis.
That's exactly true.
He's been in office for
Fortunately,
over
this
4
isn't an
years.
election year, so we don't have to worry about it right now.
Sorry I started that.
Do we have any more questions?
We just wanted to get a feel for the people here tonight, right?
And if anything, you could take that back to them and say, look, Hardesty, you know, you need to step up and be an advocate for the taxpayer, not an advocate really for a homeless program, in the sense that, yeah, we got a problem, but these people need their protection as well. They're the ones that are paying your salary.
Well,
Right.
and we're victims now, and at some point in time, we're gonna be criminals.
That's the hard part, and I agree with you, because at some point, it's gonna be a mass shooting.
Oh, yeah.
Or something mass, people are gonna take it in their own, because
Yeah.
they are not getting the attention, and that's, you can take that and, you're nodding your head, you know what I'm talking about. It's gonna, the AK-47's gonna come out and just let it rip.
And then we're gonna go to jail when the people that are terrorizing us are the ones that should be in jail. And we're gonna be the ones that go to jail
I mean, they
for
literally
protecting our
call me
families.
when the bullets hit your house.
There was the behind you, and then we'll come up.
So a couple of things, at the risk of like sounding combative, we all have to remember we have a lot more than a lot of the people who are out in the street. And it's not necessarily them that's the problem, it's the systems that put them there.
That's right.
So we need to think about what individually each of us can do, with our resources to help solve the problem before it becomes a problem. I mean, of course, we all agree that there's this massive issue. It is an issue, and figuring out the resources, you guys are slammed, I'm sure. I mean, you will be once people know more about you, which, I appreciate what you do. But I think all of us need to challenge ourselves too, to think about with our resources, what can we do to help solve the problem? Because we can't expect people who have nothing to solve the problem for themselves. And obviously we can't rely on our mayor either to solve the problems. We all can agree on that at this point. But just a challenge for everyone, just to think about where you can use your strengths and your resources to help versus, making threats of violence. Not to say that that's what's happening, but that is certainly something that does happen as a result. When people feel threatened. And so I understand everyone feeling threatened, but I just think personally we each need to challenge ourselves too.
Oh, I'm sorry, what resources are you talking about? I have no resources.
You have a home, correct?
Excuse.
I have a job.
Well, and that's the thing is we need to recognize that that's also a resource, right? That's a privilege that you have.
That's a privilege to have a job?
Absolutely.
And I appreciate you saying that. That's actually something that helps me with a lot of what the work that I do on the street is looking at my lowest of times, looking at the resources, the little that I had, and the complications with my job, with my home. Trying to navigate some of these services is near impossible.
Yeah.
So then you add the mental health, the drug use, all the things, and it compounds that problem to get out of it even more. And when you're desperate, you do desperate things, and a lot of those desperate things are criminal, right? So we're not trying to negate how you're feeling. I understand the victimness of having this problem, waking up, seeing it on your street. So anytime somebody parks on our street, my neighbors knock on my door because I'm the one that has to solve it. I'm off duty. I want to rest too, but that stuff keeps, literally my cars get broken into. I understand. That's what I'm saying. When I understand you, right? I used to walk to the store this way, but I can't because the path in North Portland, same thing. It's you have your spring water, I have the path in North Portland. I'm not going to let my kids go down that street. I'm not.
No.
But I have the capacity and the privilege of this job that I can try to find that one person when they're calling out for help, try to give them that dignity, try to give them that step up, try to give them some of the resource that I have. And I think, like, to the point of the person in the park, the text, literally, I was dispatched, if they're okay, we want them out of here. And that's where it's just like, that's one of those ethical questions that I have. It's just like, who do I serve at this point, right? And so I appreciate that comment, because this is a problem that it feels like my hands are tied. Like, what do we do? I would love to just go and say, hey, Mayor, this is what you said to me to my face, but I can't do that because of the system, right? So it is a systemic issue, not a person issue. So I do appreciate that.
Why don't we enforce the laws?
I'm not a police officer.
Yeah, he's
Well,
just a resource.
one thing, I mean, the lack of boundaries on the streets, I won't get to that topic, but one thing is, in Seattle, a volunteer was able to get 30 people off the streets in 30 days. They have an application that if you have a need, you could vote And there's accountability. So the nonprofits, there's a lot more accountability. In Portland, we don't know who's doing that, what, we don't know who's accountable, we don't know where all this money is going. It's, nobody knows. Like if you knew, like, I see somebody, I call this person, you can get help. We just don't have that in Portland.
I have a good list of numbers that I can send out, but yeah, you're right.
But it's not, you don't want a list, you want somebody that's gonna take action. Like I have this number, can you help me find this house? Can you help me get this?
Oh yeah, I understand that. I'm a case manager,
Oh, okay.
so I'm like on phone with all the resources.
Yeah.
Who do you work for?
I work for the state of Oregon at the vocational rehab. So that's also another resource to share with people too. Anyone who has a disability qualifies for vocational rehab. To get them resources, to get them training, to get them employed.
Yeah, I'd like that information.
Yeah.
They were able to get, just volunteered, had no experience whatsoever with helping people on the street. They were just cleaning up garbage, around there for dignified living. They were able to get 30 people just because they were able to talk to people that could take action. Now, we have the same people here in Portland. We don't have the data or the systems to help us. The things just slow down.
But that's where we,
So, and now for your question.
Okay, so Oregon is rated, I think, near F for treatment of drug addiction. It just hasn't been a priority. And we all, not just Portland, we're all suffering. Do you see, and we see it on the streets, right? Because you want to help. Do you see, advocacy maybe working with the governor? And, at this point, I'm not interested in Portland with, we have the law of no longer using straws. We're at a crisis point. We don't need to be worried about banning straws right now. We need to be, working on this humanitarian crisis. And the state seems really distracted with all these issues. You almost want to say, all hands on deck. Well, let's really focus on this, drug addiction. And so, but we really need it at Salem. And also, I don't know if we can have some of the universities help with OHSU and some of these research universities and say, let's mobilize the whole entire state of Oregon to look at this drug addiction and how to help people.
Well, actually, they did. They legalized the hard drugs.
Well, but to get...
They did take a look at it, and they said, well, we can't stop it, let's just let them have it.
That's right.
I know, but to get people off...
Citizens of the state voted yes. That was not a legislature thing. That was on the ballot. And we
voted it in.
We voted for it, so we no longer have that carrot.
So they say we voted for it.
I'm going to arrest you, or you can go
So
in
they
and
say.
cover it up.
So they say, because everybody that asks, I'll ask everybody in the room, did you vote for legalizing those drugs?
Yes.
No.
Yes, they did.
Sorry, I want to stir the pot.
I think if you go to the other side of the river, you'll find a whole bunch of them that
I
voted.
just want to answer the question
Thanks,
really
Peggy.
fast.
Because they keep also voting that we're going to give them more money. We're done giving them money on this side of town. Okay, are there any more questions?
Oh, I was going to answer her question really fast.
Yeah,
Randy?
question about.
Hold on.
Randy had a question. He had his hand up.
Wait, can Robin wants to answer?
Let's finish with this question.
Yeah. I wanted to anscer her question really fast.
I thought we had. Okay.
So Senator Wyden has the Cahoots Act, which is federal legislation to help fund this. That would also, I believe, help go and fund sobering centers or detox centers as well. The state is also looking at passing a $10 million grant to help create programs like this. Then I think another piece of that is the addiction treatment also has to be a part of that program. And then I was really actually quite encouraged. Recently there was a city council work session that happened last month, and the commissioners were talking about the need to really start focusing more money and attention on treatment facilities in general. And so that's one of the reasons why I think it's so important that we as a program, and like you were saying, along with the county, start collecting that data and having those conversations, not just from a legislative local government standpoint, but I think we can also bring in the healthcare payers, the CCOs, to help start funding some of that as well, because if we can divert people away from the emergency departments, it behooves us all, right? So I think there's lots of opportunity there. I'm actually quite optimistic. I think it's still a large climb forward for sure, but I'm glad that it's really starting to get the attention. I feel like there's some momentum there, so that's good.
When you're in Washington DC talking to them or locally, why not invite them to do a town hall here so they can really see what's going on?
Yeah.
Because I can guarantee you, we're lost in Washington
That's
DC. We really are.
Yeah, sure.
There's a question back there.
Yes.
One of you two?
I just want to say, earlier you said you don't understand it unless you've lived it, right? And I really appreciate that you value like lived experience as an insight or like a specific kind of expertise. And so I was just wondering, have you ever been homeless? I'm like asking earnestly.
I live in a home,
Have you ever been
and I've got
homeless?
criminals that live across the street from me for 1 year.
I understand that. What I want to say is I just think that there's an opportunity to restore some respect and,
I've been to jail, is that what you're asking me?
no, I'm not
I've
asking,
been to jail. Yeah, I've been to jail. I've been a criminal.
I'm not asking you that.
She wants to know if you've been homeless.
Yeah, actually, I have been homeless. Yeah, I have.
Was it hard?
I don't even know what to say.
You know, I don't really.
I mean,
think
this
it's
is a
coming
joke.
from the
Are you kidding me?
compassionate sense. We're at the point where we're up to here fed up. 5 years of helping, buying water, giving blankets, giving food, making sandwiches, helping them, going over there. I mean, I don't, just not just me, my other neighbors, we all did this for a long time. Now we're at the point where it's not just us, it's the fact that what's happened is they've become lawless. And the lawlessness have allowed them to think that they're untouchable at everything they do. And because there's such a big mingle of people who have mental issues, they don't want to live under anybody's rules or laws or regulations. I talk with them all the time. A lot of us have learned to have relationships. And can I get you help? Can I help you find a place to live? You name it. We've done it for years. They don't want help. They don't want to live in some apartment where they have to live by rules, laws, or people telling them what to do. This is continually the same thing I hear all the time. So now I'm at the point that, I know it sounds hard-hearted, but I've almost kind of feel that way. And it's not that I'm not. I'm not. Anybody who knows me knows that I'm not. But it's not them. It's the people who make the laws that make you and I, we obey the laws, they don't have to. So they've learned they don't have to do anything. They don't have to, you can go and ask them. You guys know, you go ask them. How many of you, it's very few out of the hundreds you ask if you can help them get a place. No. No, they don't want to go live somewhere else. And I know that because I ask them all the time. All the time. I can't walk, I can't stop with that or see them and go, do you need help? Do you need a place to live? No. And that's what they want. So how do we change that? You can have all the apartments ready for them to move in, all the detox, all the places to go and get off drugs. How are you going to get them in there if they have to do it voluntarily? Because to be quite honest, they don't want to voluntarily go in and get help. You know it as much unless it's at a crisis point where their backup is against the wall and they're forced to do it or else. So how do you do that? Well, I think you kind of said something about what they do in Arizona. They kind of say, okay, you can't do this, so the choice, jail or go get help. These people are gone to the point where the mind trying to be all nice about it doesn't work anymore. There's a few. I'm not being so off the wall, but living with it for 5 years.
Well, and I really appreciate your values when you say that sometimes, sending someone to shelter or trying to send them to shelter isn't actually supportive to them because they've had trauma.
I know.
And so when you're saying that it's these systems problems, I totally agree with you. I think you're absolutely right that there are systems problems. I think even when you're talking about laws, I think that we could expand that to think about what is criminal justice and what does justice mean in our communities.
So I think with your values of understanding that certain resources might exist, but they're not accessible, they're not meaningful, they aren't going to sustain someone into health and well-being. Like, we don't have those resources as a community right now.
I mean, I've had homeless come into my house and had them stay with us throughout my years with my husband. And some's been good, some's been bad, but that was our ministry and working with the people on the streets. And this was back in the 70s and 80s. And then our children came and we don't do that and didn't do that anymore. It's a fine line when we deal with what's happening here in Portland, of understanding all the dynamics of a homeless person. And unfortunately, we have to put them all in a big group sometimes and say, homeless. And not one thing's going to work for it, not one thing. But we need to start somewhere.
Well, this is why we now have the Portland Street Response, because they are trying to start, but they don't have any control over the other issues.
But
they can't influence an outcome.
I'd like to be able to call them. I'm listening to them.
That's the best way to get your data is from the community that sees it every day and knows who those individuals are. Because we have interaction with that community, all of us do, that are having these problems. We know they can identify and help you get this into your data as far as, where these problem areas are, who these problem people are, what are they schizophrenic, or are they just, are they just a total, drugged out, or what's going on, So at least you can kind of somewhat determine then what level of mental illness you're dealing with.
Has Greg done his survey already?
I was just about to say, that actually reminds me, we're working with Portland State University to do program evaluation, and they would like to meet with residents and business owners to gather some of that data and that feedback. So,
Give them my information.
yeah, I'll definitely pass your information along to Greg Townley, if you hear from him, Greg Townley with Portland State University. He'll be doing like focus groups and surveys, so just be on the lookout for that.
And hopefully he can get out here sooner than later, so we can get your feelings and input now. And that's definitely something. And not just for the program's sake, but if we do it the right way, then we have that data to send to the city hall, right? So that's a way that we can capture your voice and take it to where it needs to go.
Can I say that we as our neighbors, I'm so grateful we're all here, and thank you, Sharon D. So appreciated. We as neighbors need to spread the word to our neighbors that we're doing this every second Thursday. This is a very small group. We are a large neighborhood with a lot of wonderful neighbors. Those are my neighbors.
Well, unfortunately, I think a lot of people have just kind of quit coming because they feel like it's been unanswered. It's like writing a letter to the mayor or asking the city council something. It's like you never get a response.
It can change. It can change at the next meeting. We've got to keep the opportunity open there. And we've got to let each one of our neighbors know.
We got to find a way to pound on them downtown more is what we need to do and somehow
But
get
if we
somebody's
have a
attention
larger
down.
voice in our neighborhood, which this is a very small voice. If we have a larger voice in our neighborhood, like telling our neighbors to come to these meetings and having these wonderful people here to accommodate us, and being able to draw a larger crowd, then we're going to get a larger amount of I don't know, resources to come to us possibly. It's always just trying.
What can we do to make it for you guys as a neighbor?
Quit confusing us with cops. I'm kidding.
Well,
I think advocating for some of the solutions we talked about like we are kind of desperate for more mental health drop-in centers and places.
How do we advocate for it? Because as you already know, we've gone the legal way. So what do we do? I need to know what I need to do.
Well, I think actually one of the ways that you could definitely do that is through Greg with Portland State University. When he comes, his report is going to capture all of that community voice and information. So I think that's one avenue. Another avenue, I know you don't feel like you get returned emails or whatnot from your commissioners, but I can tell you, having talked to our commissioners' staff who have to sort through all those emails, they read it.
They
Like,
do. They actually do.
She actually used to work for a mayor,
somebody
so
does
she
read
used
our
to do
letters.
that
Oh,
job.
don't get me in trouble. But, but if you focus, right? And so instead of like, it's like a larger issue, if you focus on like a one goal, right? Like to get a drop-in center in Lents or something like that, I think you'll have more power having that focus on something that is a solution, I think.
Will we ever have Greg here, a meeting?
We can
Probably,
certainly.
yeah.
I'd recommend that, if he's involved with the data.
So
correct?
we'll be doing a 6-month program evaluation update to council. That'll be in August. So that might be a great month for him to come out here and he can share. I can also come with him and we can share an update or 6-month update to you all. And you can get that. And then we'll do a 1-year update as well. So next February or March, we'll be doing that to council. And that'll be our 1-year summary.
Will he be willing to do a real meeting as opposed to a Zoom?
Yeah.
I think he's getting vaccinated.
Yeah, he's
so-
getting vaccinated really soon. And we're all vaccinated, so that's why we're here.
The
but,
issue is people are not willing to come out to meetings.
Yeah.
Yeah.
Oh, you want us to actually come and see people? Oh, no, we can't do that.
Yeah.
Sorry, it's a COVID defense and it's not holding water.
He
They would
was
rather
out,
sit at home and do this.
he was out here at the very first meeting that we came to. He was a part of
Right.
our presentation then.
That's right.
So yeah, and then I think since then I was the only one to come out the last time. But now that we're all got the pokes, then I think we'll be out here a little bit more.
Yeah. As more and more people are vaccinated, they'll come
Yeah.
out.
I wanted to make sure, I thought there was a question in the back. I did.
Yeah, Randy had a question.
Did you have a question, Randy?
I think
No,
we lost
actually,
it.
kind of a statement if I can make one.
Sure. Yeah.
My name is Randy. Lived over in Lents for 30 years, and this is a good thing these guys have started, but I see the same thing happening here that happened over there. There's a lot of talk, there's no action. I'm a driver's education instructor. I get all over the Portland metro area, Beaverton, everywhere. This is an epidemic in Portland. You go out to Lake Oswego, Dunthorpe, Burlington, Tigard, Tualatin, all these places, they're not, the Oregon City where I live, they're not there. You know why? Because the city councils care. Sorry, I'm covered up here. City councils care. Oregon City meets them right on 213 before they get into town. Guess where they go? Back to Ted Wheeler. Back to your lamed up mayor, your lamed up commissioner. And the only way this is going to work is you have to band together with everybody else. You go over around the racetrack or the horse racetrack. 10 times worse than what you guys caught it. This is an epidemic in Portland because of the leadership. And I say this, and I've been saying this for a long time. Shar will say this, and David. Let's go camp out at the mayor's house. Let's make a statement. You guys are doing a good thing. I don't know what you do.
I'll provide the can.
But I don't see anybody taking minutes. I don't see where there's going to be any information unless it's being recorded. Okay, thank you. That's video. Who's writing anything down? That's not what I'm trying to point out. This is the city of Portland. This is Ted Wheeler. This is the commissioners. They are useless, just like Seattle's. And unless you band together with everybody else in Portland, where this is, in my opinion, this is an epidemic in Portland, Oregon. A few times I'll have a lesson at 8 o'clock at night, driving back through Interstate Avenue over there. This is the worst I've seen it as far as rats go. There's a decommissioned bus stop right there across from the Moda Center. There was at least 16 rats running around in that. So I pulled over and put lights on the camps. They were in and out of the camps. So what's happening here is the city council is letting this happen because you're letting them let it happen. And that many rats makes me sick because that's disease. That's all I wanted to say, you know, I want to get involved.
Colorado.
You know, so I was involved with that other. Okay. I'm not running for office. At any rate, now, thanks for letting me speak. I appreciate it.
Thank you.
Okay, are there any more questions for these fine folks who are out way late after dark?
I was wondering about how your city sanitation thing is working out with these portable toilets that the city's put around in different spots to try and alleviate some of the.
They don't do garbage.
Well, but that's not to, they don't know anything about the sanitation.
Well, I mean, I do know that there's not a sanitation bureau for the city of Portland. I know Metro does some, and then there's private contractors, but that's the sanitation. That's just my knowledge of living in the city.
Yeah, because what I seen was a whole bunch of red porta potties went out, and then that was that.
That was also a partnership with the city and then private entities to create bathrooms as a public right? If we have a problem with people urinating and defecating in the street, a porta potty every so often is better than just in open air, and I recognize that it still happens. I do.
Have you noticed a difference?
No, I
since
haven't. What I've noticed is an overflow of all the porta potties that they're not being maintained and that nobody's using them anyway.
Well, they're being maintained 3 to 5 times a week, and they will come out 24 hours a day if you call them. If you see a problem, they will come out at midnight.
So they are actually maintained.
Oh yeah, no, they're out there. Some of them get serviced every day. Some of them are 2 or 3 times a week.
Okay. Well,
They
that's
get
good.
phone
That's good to
calls
know.
in the middle of the night from people that the doors have been ripped off, or they burn well. They go out in the middle of the night and they put new ones in, but they are, and they're very responsive to consumer complaints.
Well, that's good.
Who is
because
they?
I've seen a few.
Who do we
that
call?
was-
Oh,
The number's
let
off
me
porta
find the
potty.
phone number.
Is it on there?
How
I
about,
believe
if
it.
I wanted to call you guys, how do I go about calling you?
Well, you mean for our services? Yeah, you have to call 911 or the non-emergency.
And then say,
You can
I'm
request Portland
requesting
response.
Portland Street response. They'll
Okay.
have a series of questions,
Gotcha.
Yeah.
right? And so there's only certain kinds of calls we go on. And so by their questions, it'll tree out which, should it go to us or not. So, yeah, but you can ask for us.
I have one, because I have a complaint because I live right across from that no man's park, and across Johnson Creek is that great big area that they did the big video, and I go for my walks with the animals, blah, blah, blah. They're always defecating. There's toilet paper all on that side. They have little pipes and you name it that show that that's where they're putting their waste down in Johnson Creek, and they've done all this. Anyway, I know that there's 2 porta potties within walking distance, but they don't want to walk out.
And nothing can be, they can't fix
Nothing can be
that.
done. Yeah, thank you.
The rules about where they could be placed were real specific,
Yeah.
and they can't put them in a park. It's got to be on a public right of way.
Well, this isn't even a park.
But,
Green space.
yeah, it was a real specific, you can go here, but you can't go 4 feet this direction,
It's so sick when you
6
see
feet
all
that
that
direction.
toilet paper.
But, and they are making a difference. I don't have any in my neighborhood, but where I walk, because I walk the spring water every morning.
It's gotten better smelling, yeah.
Oh, that you could, and you definitely know whether it's coyote or human.
Oh, I know. Been
So
smelling
it
for 4 or
is
5
making
years.
a difference.
Well, it's not too much over my head.
But I will be happy to give you the phone number to call if you would like to know who to call if you see one that's stinky or smelly or
One
whatever,
in this area.
because they are responsive.
Yeah.
I just, with, more people living on the streets, and especially what we see on the streets is there is, especially if they're under influence of certain drugs that, make the brain do, behavior we might not be expected. There's just not a lot of boundaries, more people, there just seems like there's more room for conflict. Do you guys, if there's a conflict situation, do you guys see yourselves, can we call you guys and say, can you guys de-escalate the situation?
Yeah, please call 911 or non-emergency line, absolutely. And if there's a weapon on scene, it'll go to police. If there's no weapon on scene, and it might still be somebody intoxicated, it's a if you think, but it'll either go to us or police. I think they're trying to divert more to us. So, and you can always, like I said, request Portland Street Response. And then, yeah, we'll triage it and send us on our way.
And in the future, we are interested in coming out to groups such as this and doing de-escalation training.
Yeah.
We're not there yet, but so that, yeah, like if you're seeing it and you want to know, like, I don't know, this is an unusual circumstance for me and I don't know how to work with someone who's in a mental health crisis, like what should I do, you know?
So are you trained in dealing with somebody that's mentally ill, or do you have a psychiatrist that you're communicating with?
No.
We have a licensed clinical social worker on our staff.
Oh, do you?
Yes,
Okay.
yeah. So she pairs up with Tremaine and the two of them go out on all the calls.
Although sometimes I think she's just my personal therapist. But no, just not to make light of the comment you said earlier when you are calling and the first thing they ask is the weapons, but because we are not law enforcement, that's why you will get that. So even if you request us, you will get that. Something that I'm advocating for is that weapon is a broad term. A lot of people, almost every person out there has a knife of some sort. It's their personal protection, but it's also a tool, right? And so I personally am saying, do you see firearms, right? Because we had a client and they had a pocket knife, and in part of the process of doing our de-escalation, I just reached out for it. They put it in my hand and problem was solved, right? I'm not gonna go to somebody with a gun, right? That is a police response. I feel if you see somebody, if they have something and they're wielding and slashing, be descriptive of that. If you see that they have a pocket knife, I'm not telling you to fabricate anything, but if you see somebody like has a blade in their pocket, that's different, right? And there are de-escalation techniques with a blade versus a firearm. So there's, and this is definitely a pilot project statement. I'll just make that known. While I'm on the pilot project, this is the level of risk that I'm willing to take, right? And I feel like that's probably the one thing that I could offer you is that I'm willing to risk myself to intervene if that's going to make you safer, right? So when you're making that phone call, don't make up anything that's not going on. Just tell what you're seeing and let the dispatchers triage that. We are listening to dispatch, so if we hear that a call's going over there, we can start to roll that way.
We can co-respond.
We can co-respond. So when they're asking that question and you're wanting us, that's probably the most critical question is about the weapon, because that's our safety.
Well, there was a saying going, it started a couple years ago, boy, if you're having any issues or problems, make sure you tell them that there's some kind of a weapon, the police, so that the police would come, otherwise they'd never come. And I'll be honest, that's what the neighbors were telling
Yeah.
Machetes seem to be a very popular
they are.
accessory these days on the
They are.
trail, and baseball bats, and I think the city needs to do something about making an ordinance that you don't.
I don't
need
know,
to
I got a
carry
baseball
around
bat by my
baseball
bed.
And that's where I think, to the gentleman's point in the back, I don't want you guys to lose any resources, right? I don't want to not be able to carry my pocket knife, right? And so, well, machete, I mean, it's depending on how you're using it, it's either a tool, and that's what I tell my kids, a tool or a toy.
Stuff down on the Springwater Trail with a machete, so that's the way I look at it.
Yeah.
They can get a pocket knife, that's fine. They don't
I think they're done
have
here.
a machete to chop stuff up.
Oh, is it time already? I thought we had more time.
Well, thanks for having
Yeah,
us.
thank you so much.
I just want to say that, like, when I came in and heard you talking about all your trash pickup programs, it really was heartening to me. It really made me feel like what a loving neighborhood that this is and people care. So,
If we are part of the solution, we're part of the problem, and we're doing what we can do in our own little corner of the world. But thank you for coming out on your off hours, and I know you've had a long day, but we appreciate
do we look tired?
We are. Thank you very much. We will see you again.
For sure.